Today, my topic is on imaging modalities for breast cancer detection and application of photoacoustic imaging for breast cancer detection. So, I'm going to cover the contents I'm going to cover today. So, initially, I'll start with the introduction to breast cancer and various types of breast cancer, and then I will discuss various imaging modalities that are used for breast cancer applications. And in the third part of my presentation, I'm going to cover the application of photoacoustic imaging for breast cancer detection. And in that, I'm going to discuss about what are the various imaging systems used for photoacoustic imaging systems for breast cancer applications. And then in the next fourth level, I'm going to discuss about what is the role of contrast agents in photoacoustic imaging, especially which are suitable for breast cancer application. So I'm going to in detail discuss about how we can detect a spherical tumor within the breast at various depths using various contrast agents, and also how to visualize the small blood vessels present in the breast, to how we can use photoacoustic imaging as a tool to visualize those blood vessels. Then I'm going to conclude and then explain about the future scope in this domain. So, now coming to the introduction, breast cancer, it is one of the leading causes of cancer related morbidity and mortality worldwide. Globally, it's a big concern. And unless we do the early detection, okay, so the chances of the new cases as well as the mortality rate will increase. So, the solution for this is to have early detection. So, for that, we are going to use various non-invasive techniques, like before the patient is getting into further treatment. So, in the initial stage itself, the patient need to undergo certain imaging techniques which are non-invasive in nature. So, using those imaging modalities, how we can detect the disease at the early stages. So, I'm going to discuss about what are the different advantages of using a particular modality and what are its limitations, and how in a particular situation how we can choose a particular imaging modality. So, I'm going to focus on comparison of different imaging modalities used for breast cancer. One is the most popular one, that is mammography. Using X-ray, low radiation X-ray, we try to identify the disease in the breast. Then ultrasound sonography, magnetic resonance imaging, called as MRI. Then positron emission tomography, and it is in short PET. PET along with computed tomography, that is CT. Then tomosynthesis, that is nothing but 3D mammography. So earlier we talked about that first one is mammography, that is a 2D one. So this tomosynthesis is nothing but 3D mammography. The last one is thermography. So I am going to discuss about these various imaging modalities and what are the advantages and limitations of each modality, how we can use them in a particular scenario. So, before getting into the details of the imaging modalities, I wanted to give an overview of the concern, global level, the breast cancer we have to pay attention. So, when it comes to cancer statistics worldwide, as per the latest statistics, 20 million new cancer cases are registered, including all. Like it's not, I'm not talking about now in this slide, all types of cancers. 20 million new cancer cases are registered every year. That is the latest data. And then 9.7 million deaths are occurring due to cancer globally. So if you see the details, the breast cancer, the number of cases are more, new cases. Almost 12 to 30% of the new cancer cases are related to breast. Then comes the lung cancer, colorectal cancer, prostate and stomach and liver cancers. Now coming to the deaths, these are the cases that are occurring every year. Now coming to the number of deaths based on that, the top one will be the lung cancer. So almost 18 to 20% of the deaths that are occurring due to cancer are related to lung cancer. And then next comes colorectal, stomach, liver, breast cancer. Fifth position is breast cancer as far as the deaths are concerned. Now, esophageal cancer, prostate cancer, they are all in the lower side. Now, in this slide, I am going to focus on, especially if you consider earlier slide is about man, women, in all countries globally covered. Now, here I am going to focus only on among the women, which one is more predominant. So, if you see the list, so these three are prominent. One is lung cancer, breast cancer and colorectal cancer. These are the three prominent cancers that women are suffering. Among them, if you see the details, 19% is colorectal cancer, and then 32% is breast cancer, and 49% is lung cancer. So the maximum people are suffering with lung cancer. The breast cancer comes in the second category, second level. Among the women, that is the second leading cause of death among the women due to breast cancer. So now, what is the solution to this problem? Global level, local level. So the solution is to detect the breast cancer early. Okay. Now we need to identify what are the effective strategies to detect the breast cancer early, so that we can reduce the number of cancer-induced deaths. That is the objective. Now let us see, before getting into the details of the imaging modalities, what are the different types of breast cancer. So if you observe the anatomy of the breast, there are these are the anatomy of the breast. I am showing you the front and the side view of the breast. So the breast cancer can originate any of the parts, especially the ducts and the lobules. Lobules are actually these are the glands which produces milk, and the ducts will carry the milk to the nipple. So generally, the cancer, breast cancer, generally it originates either in the duct or in the lobule. So based on that, the breast cancer is classified into either ductal carcinoma or lobular carcinoma. Suppose if the carcinoma, that is the malignancy or the disease, is limited within the tissue, that region only, then that is called in situ cancer. If it is spreading outside the tissue, that is called invasive. So based on that, we have again further classified into four categories. One is ductal carcinoma invasive. Invasive is that is crossing, it is originated in the duct, but it is crossing the tissue region. So that is invasive. The next one is ductal carcinoma in situ. It is there in the disease, but it is not spreading. Now coming to the lobular carcinoma, again invasive or lobular carcinoma in situ. Like that, we have basically any breast cancer can be categorized into these four types. Now, I am going to give you a brief overview of the management, how to manage this breast cancer. So there are three strategies. One is we can detect breast cancer diagnosis, and the management is classified into three categories: breast cancer detection, diagnosis and screening. Now let us understand the difference between these three. So especially the breast cancer screening, it is performed to the patients who don't have any symptoms. That's called technically we call it as asymptomatic patients. So normally what happens as the woman crosses the age of 40. So as per the American Cancer Society recommendation, so once woman crosses 40, 45, 50 in this range, so even if they don't have any symptoms, it is recommended to go for yearly checkup, screening checkup. So that if anything is there, that can be detected early and the treatment can be started at the beginning stage. So that is a recommendation given by American Cancer Society. So the screening is performed on asymptomatic patients, and here the kind of tumors that we detect in the screening, they are all of very small size. Okay, they are confined to the